to Joanne Grainger, who's going to join us now. I just want to check that Joe's with us.
I'm here, yes.
Hello, great. So great, well, over to you, and please commence.
Brilliant, thank you very much. Like Chris, I haven't done a wordy slide at all because I thought that my presentation may change after listening to the views of others, and it absolutely has, so I'm glad I didn't put a word presentation together. What I have done is just shown examples of the people that we're here to support and the types of accommodation that we're currently expecting to live in, good and bad. So they will just roll round in the background. So, I think today what we've heard and we all know about is the importance of a home to people. And I think that's come through in every single presentation that we've had, and how a home can give people a sense of control, purpose and well-being. And we all know and have seen or experienced the results when the accommodation has a negative impact for people who require support. And I think this was really well highlighted earlier on today, and it has been highlighted a lot through the pandemic. And we cannot afford to forget this and allow ourselves to go back to the old normal. I think we need to forget the old normal, and looking forward to getting back to that. I think we need to pause and really look at what we need to be doing going forward, because what we've got is not good enough. And I think the pandemic has highlighted that more than ever. And we have a duty as care professionals, as housing professionals, as people engaged with vulnerable clients, we have a duty to move on and to drive positive change. So health, housing and social care, I think how many years have we heard health, housing and social care and the integration of the three, and how have the challenges been addressed, you know, over the last few years? And we've seen clinical commissioning boards, we've seen the better care funding, we've heard of transforming care, we've heard of direct payments and health budgets, all of which were supporting us on that agenda. And unfortunately, we've not seen many really positive results that I think have come out of that, although there are some pockets of that. And I do know that some progress had been made where we saw the combined authority within Manchester, and I did some work with them to understand how that had worked. And although there were some real challenges at the beginning of that, what seems to be coming out of that is really positive results, where people are not precious about their own particular area and their own particular budgets. And I think, what are the boundaries to health, housing and social care coming together to work? We've all got exactly the same ideas about what we want to be doing for people, and there seems to be some barriers there, and I'm not sure whether that's language, whether it's difference in priorities, or whether it is the clear separation of the budgets and the inequalities in how those budgets are played and responded to. And just to draw on that point, during the pandemic, what we've seen is the government allocated £3.2 billion to local authorities to support through this pandemic. And from the recent ADAS survey, that showed that only 518 million of that 312 billion was committed to providers of adult social care. And so far, only 194 million of that has actually reached the front line. And I think that shows some of the inequalities in the budget and how the budgets are perceived to be used in the right way to support people. We've heard lots about the impact of COVID on different environments, and we've heard some really great examples and innovations that have been put in place to respond, that have provided really great solutions. And as a provider, we provide a range of services, all for adults. So we have temporary accommodation for people who have been homeless, people experiencing and challenging domestic abuse situations, through to supported living and nursing homes for adults with learning disability, older persons accommodation, community services, day services. So we provide a full range of different housing and care and support solutions for people across the whole spectrum of adult social care. And what we've found is that every single area has been impacted upon, some more than others, but everything has had an impact. And on analysing the impact of the virus, what we found is it wasn't actually the care and support service that was impacted upon, other than the ability, and Bruce touched on this, the PPE, Bruce, I think has to be said, is a headache that we don't want to ever revisit again. But I think also staff having to self-isolate and the challenges of keeping staff in work and keeping them safe and well was across the piece. But what we saw more than anything was that people's accommodation either helped the situation or considerably hindered that situation. And some examples of that, you know, you can see on the screen. If you're a single mum, if you've been fleeing domestic abuse and you're sitting in a small room with very, very limited space, that situation cannot be good. Where you've got 3 adults with learning disabilities who can no longer go out in the community, they can't go have their one-to-one time, they can't go to day centres because they're closed. All of a sudden, those 3 people living together is already a challenge. It's been a considerable challenge in that type of accommodation during the pandemic, and one where we've had to bring in additional resources just to keep people sane, really, and to keep them well and prevent them killing each other in some situations, it has to be said. So I think the home environment has actually been as much of a challenge in most services as the care and support has. But I think some things should not have come as a surprise to the sector. I think that we talk about the high rates of deaths in care homes as if we're surprised by that. But it's no surprise that if we have an outbreak of DMV in a care home, it generally goes through the whole care home. If we have a virus, or we have somebody, you know, with a really bad flu, we expect that a lot of people in that care home are going to get that. So actually the impact of coronavirus is exactly as we would have expected to have seen with any virus in a care home environment. It's the outcome that's shocking. The fact that that number of people have lost their lives early is the shock. The environment itself lends itself to the spread of germs and the spread of viruses. And I think that to think that that was a shock was, we should have been prepared for that. We should have anticipated that people being stuck together, even families who go out to work having to live together, we were going to see a high rise in people experiencing domestic abuse with the challenges alone of its pandemic. So I don't think that should have been a surprise. I think the big surprise for me was how quickly the government managed to get rough sleepers off the street to prevent them going into hospital when we went through a winter where a significant number of people who were homeless died from the cold, and we didn't have the same level of response to that particular outcome. So I thought that one of the positives of this is, for the first time, we've seen a real drive to remove people from the streets and give them a roof over their head, and for them to be treated in the way that they should have been treated. We did see less of an impact from the virus in our extra care accommodation. The social isolation was nowhere as near as challenging. You've still got your communal spaces, you've still got Nellie living next door and Bob just over the corridor. We did communal garden activities, corridor activities, lots of things to keep people engaged, and there was a staff presence on site 24 hours a day. So that feeling of isolation in extra care was considerably less than people living in communities. And the impact of having to stay in with lots of other people was considerably less, because people have their own private apartments and there's not the need really for them to be stuck in the same room with other people that they may not want to spend their whole days with. So I think that all of those things were great. And the use of assisted technology, as was touched upon earlier on in Bruce's presentation, we found that was absolutely fabulous and really did help us to get people integrated, both within our supported living accommodation and in our 20,000 general need properties as well. But we've just heard from Chris on the housing inequalities and some of the challenges there. And we've heard from Meredith on innovative housing solutions, and from Bruce on extra care housing and integrating BME communities, and also looking at affordability to be able to accommodate people who can afford to purchase their own apartments through to people that can only afford to rent. And I just want to push that a little bit further really in relation to innovation, and linking back to Chris's presentation around communities. And what is extra care if it's not a community? And one of the things that we are looking at is, why is extra care still age specific and not related to the needs of lots of individuals? So having the benefit and the luxury of being able to manage lots of different types of accommodation for lots of people with differing needs. On our newest development that's just being built as we speak, we've removed the age restriction, and we are saying that if you have a need to live in this type of accommodation, then we will look at how we can support you to live in this environment. And in previous developments that I've worked on of extra care housing, we've taken away that age limit, and we've seen people in their 20s living with people who are over 100, and building their own internal community of support, which has been absolutely amazing. So I think we would have to start to ask the question, is extra care, should it still be age specific, or should we be building what Chris talked about, communities that represent the community that we live in? We all know that there is a lack of accommodation for adults with learning disability. Shared houses can't be the way forward. How can somebody enter into a personal sexual relationship when all they've got is a room in a 3-bedroomed house? How can they have visitors round and have a party if the 2 people that they live with want to watch the television? You know, there are so many challenges. What we need to be building is communities of people who have the same levels of need, different needs, but the same level of needs. And we need to be making sure that these are available to the people in that local community. I think we need to start to address the challenges in funding. These schemes, as pointed out by Meredith, they come at a cost. All the additional communal spaces that we build have to be funded, not just from a development perspective, but later on from the running of this service. We need to have 24-hour staffing on sites so that it enables people to have that security and peace of mind there. And how does that get funded? We've seen the removal of supporting people funding. We saw then intensive housing management costs being put through service charges. We're now seeing the scrutiny of charges linked to housing benefit. So how do we fund all of this preventative stuff, the things that keep people safe and well and active, both physically and mentally, without really looking at how we can do that and how that gets funded? And then looking at where
the team of recognising and thanking for a job well done.
Sorry, a voice just popped up in the middle of there. I'm not sure where that came from, but I know that time is of the essence here, and I know that we'll be pressing to end that. But I think, kind of to leave on some thoughts, we need to lobby for adult social care. We need to be lobbying for the adult social care promised green paper that's never raised its head yet. We need to be looking at funding for adult social care, and we need to provide good accommodation and good support services to enable people to live their best life and to deliver great results. And I'll end it there because I could go on forever about this, Jeremy, so I'll end that there. Thank you.
Jo, that was really succinct and great, so thanks ever so much. Do stay on, because I'm going to invite you and Chris just to reflect on the conversation, and also we've got a number of questions and comments coming through. My first question is really to pick up on something that Sheila raised, Sheila McIntosh, which is something about sort of the streetscaping and understanding better healthy connectivity through better use of space, and some of the stuff that's happened in Barcelona about reclaiming streets and parks. Chris, are you familiar with any of that greening of spaces and perhaps the way that town centres perhaps are being reused?
Yeah, so it's something that that was touched on in the Healthy New Towns programme, and I think whenever we talk about kind of housing and health, that conversation doesn't just end at the front door, does it? It's about the kind of wider sort of neighbourhood and public places and spaces that can be designed in a way that's health promoting. So in terms of kind of specific practical recommendations, as I say, I would point people to Putting Health into Place, which is the final report from the Health New Towns programme. That has a whole section on, how do we build kind of compact, complete communities that have, what we need to live a sort of life, within walking distance wherever possible of our homes. There's great examples to draw on, both from that programme and some of the European examples that have been mentioned already.
Oh, that's great. Now, Jo, you've got loads of comments in the chat box around, some of the real ageist attitudes we have around our extra care housing, and your suggestion about opening them up to all ages has got a really overwhelming sort of response. I think if we were to have a poll, we'd probably get about 80–90%. But beyond that, do you think we have got an issue about ageism in our housing sector in terms of how we classify where people should live, what the choices are available and the like? You talked about some of those silos. Do you think it goes more that there is sort of elements of institutional ageism even?
Yeah, I think there is this kind of general view that older people only want to mix with other older people, and that they don't want somebody younger with a learning disability, you know, kind of sitting opposite them at lunchtime. And there were a lot of those barriers when I first started to explore this a number of years ago. There was some apprehension about how this would work and whether it would work at all. We had some of the stigmas around even older people with dementia. Why are those people being allowed to live in here? They should be in a care home. And I think it's around the way that we present things, Jeremy. I do think there is that ageist view. But actually, in the last scheme I did, which was in South Staffordshire, as I say, we had our youngest resident was in his 20s. He'd got an acquired brain injury. He had been married with 2 children, had an accident, couldn't live at home because of his mood swings. And he moved into there because his family were living down the road in Penkridge, and we really didn't want to split a family up. And then we had a variety of younger people, mainly with learning disabilities. But what we actually found was, what was amazing about this whole concept was some of the older people would give their shopping list to the younger people who were going down into the local village. They were doing the shopping and bringing it back, and the older generation were cooking for the younger ones and sending them a meal round at tea time. So it created its own support networks within the actual environment of the scheme. And I think, is that not what we want to create? Communities of people with different skills and different abilities, and encourage them to support each other as much as rely on the staff for that support.
And it appears to me that we're sometimes confined by the lack of choices, which makes us have to look at more at segregation, either because of the funding streams or because of the way sort of systems are planned in those localities. Again, some really interesting and excellent points being made up about, you know, are there examples of intergenerational extra care schemes? Yes, they are. There are examples both of schemes that are developed with intergenerational living in mind across all ages and with people with disabilities. And I think the point Lynn made much earlier on is we need to think around this inclusivity. Chris, you talked very much about the social cycle, psychological impact. You know, I think again, are there any things coming out of the lessons of COVID to date which show the impact on people's, you mentioned mental health, but longer term around their health and well-being that you're aware of, sort of upcoming research or findings?
Well, certainly there's modelling work going on within the NHS at the moment, trying to understand what the impact of COVID will be on mental health needs across the country. I think the assumption is that they will be driven up, and that's both you know, as a result of kind of people developing kind of depression or anxiety as a result of the way we've all been living, but also a second sort of the other side of the coin is people with existing illnesses, you know, sometimes severe mental illnesses, who haven't been getting the same level of support either formally or informally as they would do previously, who've been relapsing over the last few months, and we've heard of kind of cases of that. So both of those things will certainly drive up demand for mental health care, and we need the sort of modelling to understand by how much. I think there's some kind of broader lessons from the COVID period that might be interesting in terms of how does you know, so there's this evidence out there that living in a place where you have kind of strong community connectedness and community resilience kind of puts you in a better position and makes a community more resilient to absorb kind of shocks and when they come along. So one of the really interesting things that I think we need to be doing research on over the next few months is looking at whether that has been the case during the COVID pandemic, and has all that theory about kind of community resilience played out in terms of different communities across the country faring, you know, more or less well during the crisis. So that's something we may be doing work on at the King's Fund, and would be sort of interested in hearing from others on that as well.
Well, it's interesting because I mean that sort of resilience model. I'm conscious of some of the work that's happened in Wales about developing an anatomy of resilience, but it very much shows it's a bit of a postcode lottery in many areas because of the type of communities that already exist there, whether they're fractured or not. And perhaps that's been exposed a little bit more back to those health inequalities that you highlighted at the outset. We're going to wrap up in a minute, but I was just wondering whether Bruce or Meredith were still with us and whether they had any comments that they wanted to draw on from what either Chris or Joe have said. Do say.
Yes, I thought, yeah, the comments that have been made about extra care, I think it's as I said in my presentation, there's the plurality of provision. It's not, there's not one model that serves everybody's needs. And I think there's that's part of ageism in my view, is the view that one model is going to serve all older people. There's such a variety that some people want to live in mixed generational extra care, retirement housing, general housing, and the whole range of provision is what we need to, in my view, be focusing on, rather than just finding one model that fits everybody, because that will never happen. And I think it's recognising it all in the process.
Thanks, Bruce and Meredith.
I would say support that. And what's been really interesting is, as an architect, looking at the housing guidelines that have been developed to enable housing for the elderly or for extra care to work more efficiently or effectively. They're applicable to all housing. So applying the lifetime homes provision or the principles enshrined in the Happy reports to housing simply makes it better housing, and therefore makes it possible for all people to live together.
Well, thanks for that. And making those connections across housing, health and care has been implicit in today's event. And it really only leaves me to sort of, the last few minutes is to provide a very quick summary of today. And I wanted to sort of just start off with by sort of drawing analogies to what Bruce was saying about PPE and masks, by saying, I think what we've really done is unmasked today some of the social injustices that have existed and how the housing, working closely with health and social care, have tried to tackle some of those inequalities, both the housing inequalities as well as the health and social care inequalities. And Joe picked up on the issues around how some of that money's been allocated. And it appears to me that we need to really start thinking both around a citizen-led, user-led, but more importantly, an inclusivity approach to looking at the way we both design the physical architecture, but also the social architecture of our homes and communities, so that all people can be engaged in that. Lynn talked about, in one of her posts, about how can we ensure we have a better integration of capital investment and have more money used smartly to support investment and develop the type of interventions that we've heard about today. I think we would all sign up to the need for the better use of integrated approaches, but at the heart of that, making sure, as Alex was making sure and his colleagues this morning, how person-centered they are. We need to enable more innovation and that flourish. We're in a position at the moment where we're having to manage with so many risks. How can we take a little bit of time to think out of the box? What's going to be 6 months, 9 months, 12 months and beyond? So again, we heard about some of those technology solutions. We talked about other models of alternative to housing. Signposting people to better advice and information, supporting people at home through better adaptations and access to aids and community equipment, supporting very vulnerable adults in their own homes, people with complex needs, people with dementia. We've covered a lot around. So what are those solutions? And we've drawn both some of the national policy objectives, but also shown very good practical examples of how to support change happening and to help to reset and hopefully regenerate the way we can inform and influence policymakers and practitioners. So I hope you've all found today extremely inspiring. I know from both the questions and answers and the chat room, there's been a lot of offline activity going on. Please do continue to network. I know that foundations who generously put on the event on behalf of ourselves and ADAS and themselves will be producing a post-event conference briefing in the next fortnight or so. And it only leaves me to thank everybody who's made a contribution today, both the speakers, as well as those of you who've either contributed through the chat boxes or just through participation today. Can I wish you a safe journey to wherever you're going next, virtually, and thanks you all again for making today a real great success. And Paul, unless I've forgotten anything, can I also thank you and MHCLG and the team behind the scenes for making today really work smoothly. We've had so few glitches that I'm aware of. You've managed that really beautifully.
Thank you, Jamie, and thank you to Thea and Neil as well for chairing the session so brilliantly.
Absolutely.
And particularly thank you to Francis, who's put in lots of work over the last month in setting up all the speakers and arranging everything. So thank you to Francis and the rest of the team back at Foundations. And yeah, I think we're done. Just as you log off, you should get a link to a quick survey. So if you just give us your thoughts on the day, that'd be very much appreciated.